Hello and welcome to the Two Gals and a Mic podcast. I'm your host, Sue Kerber, and on today's episode, I'm chatting with Sexpert Extraordinaire, Dr. Hannah Wilson. Hannah founded the Oh Hi Collective, a one-stop shop for all things sex education related, and is certified by the American Association of Sexuality Educators, Counselors, and Therapists. With a specialization in gender-related topics, Hannah is committed to reducing shame around sexual health through empowerment and education. Hannah, welcome to the show.
Hi, thanks for having me.
I'm so excited that you're here. I've never had a sexpert on the show, and I just introduced you as a certified sex therapist who's also an entrepreneur and actually owns two separate practices. So let's start with your origin story. What prompted you to want to pursue this line of work? And what education did you need in order to do what you do?
I grew up in a single parent home. My mom is an absolute dynamite human who may have a little bit of worry about her oldest daughter. So there was a lot of shame and education information growing up. It was never aligned, right? And so when I went to college, I actually met this amazing woman. Her name is Laura Mensch, and she's actually here in Bozeman, who taught an advanced human sexuality course. And I have such admiration for her. She sparked this conversation that created such a space to be seen as a sexual being without it being this like really kind of grungy sex space. And I fell in love with the way that she taught. And from there, it kind of went off. And so I did a lot of other things to try to find that passion and never really found it in the way that I loved sex education. And I've been a sex educator longer than I've been a sex therapist. And when I became a mental health therapist, realized it was the piece I was missing and kind of tied it all together. Franzi Springer, who I work with really closely, who's one of the collaborators for OHI, has also inspired that education and that certification process in me, and absolutely am so grateful for having these really dynamite humans in my life that just continue to like push and foster that interest in a topic that I think is relevant to everyone, but so few have the knowledge of or the comfort in talking about.
What kind of degree does one get in order to do what you do?
AASECT is the governing board. It's the only governing board of sex therapists, counselors, and educators. So there's like three tiers, if you will. There's folks who do education. There's folks who are counselors, which is very confusing, which are professionals that work closely with sexual health, who take additional education supervision to become a AASECT counselor. And then therapists are actual therapists, counselors, psychotherapists that are wanting to include sex therapy within their practice. In only a handful of states is there any regulation around this, which means that some counterparts can take 2 hours of education and be a certified therapist. AASECT has a much more rigid certification process. So my path, I got an undergrad in community health and sociology from MSU. And then I went to Walden and the Kinsey Institute for my master's degree as a clinical mental health counselor, and then worked to get my licensure in Montana. And then when I was working on my sex therapy certification, I actually did a PhD in clinical sexology with a kink conscious focus and a gender focus, and then had to do, so many hours of direct client contact. I had to receive so many hours of supervision from a certified sex therapist. And then I had to have 150 hours of additional education, which happened to be with my PhD. So I have a really big breadth of education. It's a broad spectrum because sexuality is so broad, but I have a lot of years in education and therapy of how to apply that, which is a little bit different than someone who's saying that I'm a sex therapist. A certified sex therapist ensures that they have a lot more training in it.
So before we dive a little bit deeper into some of those things that you were just talking about, I want to talk about the elephant in the room. Sex therapy seems to be a bit of a risque profession, really talking about what has historically been a taboo topic. Have you been met with any criticism or opposition along the way with your choice of profession? And if so, how have you navigated through this?
I'm giggling because my mom was the first one that was like, "I'm only introducing you as a therapist." I thought I would get a lot more backlash. I haven't. I think when I openly identify as a sex therapist, I hear all of the struggles that people face in intimacy and relationships and normalizing those things. Menopause, holy bananas, just having information about what our bodies go through. I think about mindful masculinity and this constant conversation of toxic masculinity and how we can have better conversations with men. And that introduction of I'm a sex therapist immediately opens this door of the understanding that I'm not here to judge, I'm just here to be curious. And that has been one of the greatest benefits of doing this work because as a therapist, I think people are like, don't therapize me. But if I say I'm a sex therapist, they're like, I have questions. I also tend to be more of an introvert. So I found that dinner parties, I don't introduce myself as a sex therapist because I quickly become overwhelmed with people who want to like talk, which is really great, also overwhelming. So some of the education that we offer at Ojai has gotten a little more of a feel. So I think around Pride, we were part of Bozeman Pride and we got a little bit of kickback about supporting different communities. I am going to support every community, every expression of self that I can that is healthy and consensual. And I think that's important to take that stance. So, yes, we've gotten kickback, but I also think it's really important to be that voice in the storm sometimes that says it's okay and you're welcome. You're always welcome here. It's kind of a both and, but I personally, from the work that we've done, have gotten way more positive feedback and engagement than negative.
That's fantastic. You know, you talk about supporting a variety of communities, and your first business that you launched back in 2020, Prickly Peach Sex Therapy, really considers gender and trans affirming therapy. I would imagine that in doing this, your work encompasses a range of methodologies designed to support and affirm an individual's gender identity so people
Mhm,
can really live authentically. And you talk quite a bit about the importance of showing up authentically.
mhm.
Why is this so important? And how can we collectively create more empathetic understanding around such a contentious issue?
I lived in Seattle for about 7 years, and I worked with the houseless population. I actually was the supervisor of case managers in the shelter, and one of our issues was often how to house our trans individuals. How can we be supportive, but also recognize, like, safety? And a lot of these conversations came up much, much earlier than what they have in the political way. And I realized my, like, absolute love for working with this population, specifically houseless. I moved into doing work in a housing first programming, which was targeted toward trans sex workers. And that changed everything for me. I really saw the importance of identity and the ways that individuals really push and the extent that they go to truly live as they are and how to support that was so, so important. So when I went back to school to finish my master's and to become a therapist, I felt like this was a resource that I was often trying to refer to and not getting anyone. If you find a void, then show up for it. And that's what happened. It was, we need to do better. How are we offering medical care for people if we can't talk about sexual health, if we can't talk about identity? How do we create safe spaces so that medical appointments are engaging and kind? And I did a lot of advocacy around that and just loved it. And I felt it was so important for people to show up in a space that they felt safe, that they could ask questions, that they could be honest. And I think that's true not just for my trans population I've worked with so often, but my queer population, my female population, it doesn't really matter. There's such a disconnect between how to serve populations when we're not meeting them where they're at. And so it just became this massive point of advocacy. Sex is the same for me, is that there's all of these avenues that we want and need support, but because of our own discomfort, we're not offering information and sitting with people. We're just kind of throwing information at them, and that isn't working. And so I wanted to be part of that change, which was Prickly Peach, sex therapy. I went into private practice and learned how isolated people felt and how much this was needed. So I continued my education. I've continued to create a really great community to have that integrated approach. Kids are really underserved, and this topic of trans kids becomes so polarizing. And at the end of the day, we want what's best for our children. That I think we can all agree on. But if we're not informed to be able to make those decisions through education, then what we're doing is we're doing a massive disservice. And that is where I think my specialty fell into was we need to do better, not just for trans kids, but for their parents, for our community to show that we care about the people that live here and how to take care of one another. And trans is just one of the populations I work with. And I think that is what kind of drove it.
If you're, for example, a parent of a trans child, you're coming in for support, you're coming in for education. What about the community at large that may not be seeking that kind of education? How do we collectively better educate ourselves?
That are polarizing, right? That make us feel a certain way because of our own morals, our own values, our own perspectives. We have to be curious. So I think in the work that I do, I view it kind of as a triangle. And in a sense, what I sit in, there's three parts of it. There's the experiential, there's the educational, and there's the advocacy. If I want to be a great therapist, I feel like I need to sit in all of those. One is experiential. We need to validate, acknowledge, and be curious about people's experience. As a therapist, I sit in that space all day. So we have to understand that people have an experience. We're not trying to change it because it's theirs, right? But we also have this component of education, which is where I believe we can be curious. We can ask questions. We can make mistakes. We can teach people about more and offer knowledge. But we're not going to tell someone's experience is wrong. We're not in that space anymore. We're in education. And that's where a lot of community building can be. That's where a lot of space of like making mistakes and doing better, but not being unkind in what people don't know, but being curious in what they don't know and offering more knowledge. And then there's advocacy. And advocacy is just as important, but it's very black and white. It's either right or wrong. We're doing this because we have to. We're doing this because it's right. And when we often want to talk about educating our community, we go through an advocacy space, which is right or wrong. And what that does is it really minimizes our ability to be curious. It says that you as a person are a bad person for thinking blank. Instead of staying in that education space of help me understand that about you. Help me understand how you came to that place. Would you like more knowledge? Could I challenge that thinking? And what happens is that I think when we talk about this community, we have to be curious first. We cannot come from a place of advocacy and we cannot come from a place of experience. Education has to be paired in that of where we can actually be curious and creating spaces to make mistakes.
Let's dig into this idea of education a little bit more. In 2021, you founded the Ojai Collective, which is on a mission to deconstruct barriers by providing sex education to individuals and communities writ large, which is exactly what we are talking about. What topics do you cover, and how is the approach that you're using changing the narrative around a historically shameful subject matter?
I think we do it in a lot of ways. One, we're really trying to listen to what community members need. We've gotten a lot of requests about having embodied pleasure after sexual trauma. So we do work there. We try to keep these things at low cost because that's really important to us. Then we do like playful ones of like how to flirt after 40, how to date on a dating app. We're doing intro to anal sex, all the way to book club about menopause. We also lean into education for providers. So we are a CEU, we offer continuing ed units for NBCC, which is for counselors, and AASECT, which is who I'm certified through. So we invite providers in the community to expand their education as well. And then because sex isn't all that serious, it's weird and messy and playful and fun, we try to have bigger community events. So we hosted Y2Gay, which was a dance party during Pride. We do art markets for queer makers. We're putting together and organizing a kink con right now. That's a 1 day education during the day. And then we're going to do a leather and lace dance party at night. We're constantly trying to evolve and find what our community is longing for and reaching for. And that is all topics. We're working on creating a performance anxiety workshop for folks who have erectile dysfunction and how to show up and kind of shake it off because of that psychological barrier. We've done really intensive education around endometriosis and how to talk about that with your doctor and what kind of other reproductive health issues can pop up. Pain with sex. The topic is of interest. We want to know what that is, and we really try to lean in.
Where do you solicit your topics from?
Sometimes it's Instagram, sometimes it's people who show up in my office. My dissertation was on neurodiversity and gender variance. And so I was seeing that a lot in my practice. So offering like autism and sex, there's a lot of education that needs to happen, not necessarily therapy. So we try to keep it diverse and as inclusive as we can.
Well, it sounds like your guidance really runs the gamut, spanning from members of the LGBTQ community to helping everybody improve things like communication, to learn to live in relationships. You talked about trauma, so I'm sure healing from trauma and fostering intimacy so that we all can experience our most authentic and fulfilling sexual selves. What's the most rewarding aspect of your work? And do you feel like you're living really aligned with your purpose?
The most fulfilling is laughing with people. This job is ridiculous. It is ridiculous. I am handing out condoms one appointment to going over lube to talking about someone's body the next to sitting in someone's trauma the very next. And being able to like add play and laughter into this work has been so fulfilling for me because I think therapy is heavy and hard. To actually work with people to laugh together is so amazing. It's something that I look forward to every day because our work is weird. I say that all the time. Like, this is a weird job. I think I've worked really hard to create something that I'm really proud of. And not only that I'm creating, but this collective that is so important to me that I'm collaborating with people that inspire me, that fuel this inspiration and create this space that it's just we're stoked to be in. It's hard for me to believe that it's just mine because there's so many people around me that I'm just stoked about, and fueling each other's fire has been so beautiful, and I think being part of that is purpose, is that I'm not alone, but I'm part of this community. I am so blessed to have and be a part of that.
Would you say that you have an entrepreneurial mindset? Because this is the second business that you've launched in a very short amount of time. And here you are bringing in a lot of different resources, people, and assets from all over the place. Tell us a little bit about how this all got started and the business side of things.
I think I got mad. I think I got frustrated, in all fairness, with like, what in the hell are we doing? Why isn't women's health important? Why aren't we teaching our kids how to have healthy relationships? And why do we feel like they can't handle what sex is? They're doing it, they're being weird. Why aren't we empowering people with knowledge? This is bananas. And so I cannot be mad about a situation where no one's doing anything if I'm not going to do something. I found like minded people who felt the same. And that is where this collective really was birthed out of. I ended up as the foundress in the sense of capacity. I was pissed and I was like, I'm going to burn it down first. And trying to keep up with that, I think, is what set me apart in pushing this forward. And I also have to be clear, I didn't know what the I was doing, like, at all. I didn't know you needed an LLC versus an EIN. I didn't have an accountant. I didn't have anyone who was like, "Hey, these are the insurances and this is how you do it." I just started Googling and figuring out how to do it. I think it's what's made me a little better at this job because I understand it from jump, but it also really created this challenge to the imposter syndrome I think we all have of like, who am I to do A, B, and C? Not until this last, I guess it's been 3 years, 2020, where I finally had started like recruiting people to tell me how to do this. And I didn't do too bad. And finding people who support the shit out of you that are like, this is my expertise. Let me help you because I'm sold on what you're doing. And that was really a newer perspective. Working with poly couples, I'm always like, we need to get out of a scarcity model and into an abundance model. And I live that in so many aspects of my life. The hardest place for me to apply it was business because I'm doing it. If I have a hold on it, I can do it the way that I want to do it and make sure it's done. Holy shirts capacity. You don't have the ability to do that. And so leaning into that model of abundance was so much more helpful in like finding that space to do what I love instead of doing what I hate to make what I love possible.
But practically speaking, Hannah, how did you do that? How did you actually make that change?
This is messy. And I was tired of being messy. And I was tired of being tired. Gosh, it sounds so silly, but as a therapist, I think sometimes we expect of ourselves that we have all of the answers. And I think humbling myself a lot was sitting with, what do I really want? Where does my heart want to be? And my heart is in the everyday, the meeting with clients, the creating education, meeting with interns to boost them and make them feel confident. And I realized, why am I wasting all of this energy on bookkeeping? This takes me 12 hours a week. I could pay this nice lady who could do it in an hour because that's her specialty. And really learning that like humbling nature of I cannot do it all and that's okay, and I need to lean into this collaboration. So it was a lot of self-reflection. It was a lot of mistakes. It was a lot of headstrong moments. It was a lot of moments where my partner was like, Hannah, come on now. Brene Brown wrote the book Atlas of the Heart, which is all about feels. I'm not about feelings. I'm more of an observer. And so I was like, oh, I should get in the feels. But she writes a chapter on joy and how hard it was for me to sit in joy or feel that I was deserving of joy and having to shift that to like what actually brings me joy. And I need to stay in that moment and celebrate it was wildly hard. And so that became my work over the last handful of years. And that shifted my scarcity of I have to do it all to my abundance of I want to love this. And I have to let go of certain things if I want to be in my joy.
So, what does bring you joy? What did you find out throughout this journey?
I was teaching at MSU at the time. I got really bad anxiety after COVID. I couldn't teach. My little brother, Hayden, who is just this dynamite human in my life, really encouraged me to take an improv class to get over my bullshit, is what he said. But I did my first showcase and I was really nervous no one was going to show up. I thought it was going to be an empty house. And I invited my classes for extra credit. And I was like, if you guys want to come, I will give you 4 points of extra credit. I'd love for you to be there. The amount of them that showed up, present and past students, brought me to tears. Seeing how they showed up, and then we played improv games after, and seeing students who said nothing in class get up on stage and play wells my whole heart. Having people be able to show up in this playful space, to just be them, to laugh, to feel warmed and welcomed That is what brings me joy, is creating spaces and events where people can be seen without any requirement, but just to be. There's nothing better. I also have to mention that I absolutely love my rescue bulldog, Dax. He's probably my other big joy. Those two things I think are what draw me to this work and what keep me going.
I love this conversation that we're having about really pushing into the extraordinary. You know, I read something recently that said if we cling too tightly to the familiar, we will never be able to see or to take part in that extraordinary. As you have experienced these new things, as you have let the reins go, as you have allowed yourself to try new things like this improv, what is one thing that you have realized about yourself that really has astounded you?
I won't die. Trying something new, I'm not gonna die. I might hate it, might be incredibly uncomfortable. I might cry afterwards, but I could also be thrilled. I could have the time of my life. I could create a core memory, but I'm not gonna die. I've never been a risk taker. I've been mouthy. I've been a rebel, but I've never been a risk taker. Like I always knew my parameters. And so pushing that edge, I think every time I think I find my edge, I'm always surprised to find that I could actually do more.
You know, I talk about this concept of fear as a barrier quite a bit because a lot of women bring that up, especially entrepreneurs. As a business owner, what advice would you offer to our listeners who might be looking to either start, to grow, to expand, or to level up a business? Is there anything that you know now that you wish that you had known back then?
Don't know why, but the phrase like, why not you just keeps coming to mind. Like, why not you? You want to create your art? Why not? Or you want to start a new business? Why not? When you start sitting in that space of like why you can't, you're right. You're just going to get more of why you can't. But if asking genuinely, why not you? Why couldn't you? Is such a change and it flips it on its head. And I wish when I had started this, I asked that question a little more honestly and much less of a critique of self, but more of a why couldn't you? Of course you can. And not been so hard on myself that I didn't know what I didn't know. If you're willing to ask questions, the amount of humans out there that just want to see you succeed, pay attention to them because having those folks in your corner is unbelievably empowering and not just through what they say, but what they do. Listen to what people do because people show up for you if they're in your corner. They fight for you. They find those resources. They connect you. They cheerlead you when you're not in the room. Those are your people. Don't pay attention to the people who are like, oh, you got this, but don't call me when you need help, like painting a wall. Those aren't your people. Find the people that continue to show up to remind you, why not you?
They're the people that show up at your improv when you think that
Yes.
you're going to have no one there.
And cry with you because you're just so moved. And they're like, I don't know why you're crying.
That why not me or why not you question, I think really correlates to this idea of using your gifts. Doing this is what activates your superpower. Hannah, what is your superpower and what gifts fuel this?
My superpower likely has something to do with this like core belief that all are welcome. I want everyone at my table. I want every voice that disagrees with me. I want every voice that cheerleads me. I want every challenge. I want every praise. I want everyone at the table. And that superpower has really allowed for me to hear hard critiques, to sit with my mess, and to also live in those moments of compliment, to be grateful for those compliments. I'm not as great as taking those as I am critique, but I'm working on it. And I think that has become a really great superpower that I'm curious. I'm so curious and just wanting to lean into that space over and over again. If I don't understand it, I want to. So my ADHD drives that motivation. Sometimes I can't finish stuff, but I have a great team behind me, supports me, but definitely the curiosity and wanting people to show up, even in the mess.
And it's been really quite a journey for you. We've talked about some of that. What's been the greatest part of all of this for you?
I presented at AASECT last season, and I remember spending days. When I say days, I mean months choosing my presentation outfit. And if you've ever been in that space where you're like, you want the perfect one, you want it to look perfect, you want to be comfortable, but you want to be cool and you want to be like movable because I'm always moving my arms. And the day happened and I put on the outfit and I thought, I hate this. I hate this outfit so much. And I put on this pink jumpsuit. It is the most ridiculous outfit, but it is like a comfort outfit. And I presented, and it was the most meaningful thing to have people see that I didn't try to be professional. I tried to be me. And having people notice that and see that I'm showing up more in my authenticity every time I do this, that that has been, I think, the embodiment of what I've been trying to do is create spaces for people to be authentic and comfortable in their skin through knowledge. And for me to start doing that for self, I think was a really big hell yes moment.
So would you say that that was a really big turning point for you?
Mhm.
It was pretty pivotal?
Yeah, I quit trying and just started showing up as self. If you've ever met me, I wear big earrings. I'm almost always in Nike Air Maxes. I wear a t-shirt dress all year round. I'm more about comfort. And I stopped trying to be what I thought I was supposed to be and just started showing up as I am. I'm a little messy. So yeah, I'd say it was a turning point and like I don't need to do this how everyone else does.
Well, what about the most difficult part? Because I'm sure that there's had to be numerous challenges along this journey that you've been on.
My PhD was hella hard. It is not for the faint of heart. Academics was my love for a really long time because I'm a nerd. And when I realized that academics kind of becomes a point of tearing you down and not really building you up, that was really hard. I wanted to, have a PhD to be educated and an expert in what I knew. And instead, it was more about just punitive. And I hated it. Oh, I hated it, which kind of goes hand in hand. Over the years, hearing like that's not how we do it really took the wind out of my sails in a lot of ways. When I moved to Seattle at my first job, I overheard my boss, my brand new boss, brag to another staff about how their goal was to make me cry. I think about that moment of like, I became so determined to be like, absolutely not. You won't make me cry. And here I am as a therapist tearing up at a podcast of like just memories. And I feel like those moments were really defining and really effing hard to get through. But they were also this moment that I'm really proud that I overcame and learned a lot about myself, of what I'm capable of how I'm resilient, of how we just got to do the thing sometimes. There's a lot of those moments. There's so much gratitude in being able to create what you want and be it an image of how we can be better and making those challenges of self and saying, like, I don't like how this works. I'm going to change it because it's mine is one of the most empowering things that came out of those really hard moments of feeling helpless or hopeless in changing the system or changing the way that we do things or the way that people treat one another. I want to be better. I really like to believe that I'm trying to create that with the staff that I have, with the opportunities I try to offer interns, in the education I offer, and making sure people feel welcome and being exactly as they are.
So you put on your pink jumpsuit and you pushed forward, and now you are operating with expectation of what's to come. So let's talk about what's in your windshield. What's next for you? What audacious goals are you chasing?
We're going to tackle a kink con. This is bananas. So we're going to bring in educators around introduction to kinky things, around education of negotiation to what are kinks and how to play in them. I also am really thinking about expanding Ojai to have another location. We're working on that, definitely in Montana, because we get people from all over Montana And while I love telehealth as an option, I know that in-person sex therapy is better in the sense of like being able to read the room and creating a relationship, which is what we're doing. And then really learning to slow down is part of this next couple of years of how do I love what I do and not let it encompass me? Because I could do this 24/7 and be thrilled. And I'm still a human and I really have this lovely relationship that I want to make sure continues and being able to like enjoy that space. So it's kind of a like, how do I do what I'm doing really well and be able to hand it off to people to keep this thing? And also, how do I slow down a little and maybe not always work?
How do you do that? What strategies do you use to create balance so that you can live with intention and show up authentically?
I think oftentimes, even when I work with couples, we do this thing where we're like, what do you not want to do? But it keeps us in this negative cycle of thinking. These are all the things I don't like. This is what I don't want. And instead, I'm kind of leaning into this more positive of what do I want more of? What did this week feel for me? And a lot of that comes back to home. Being at home is what I want. So, how am I going to do that just a little bit more? How am I going to be a little more intentional? And how am I going to hand maybe one more thing off this week so that I can spend, an extra hour at home? And also recognizing that a lot of things are temporary. So, if I have to grind right now, how do I balance that with some time off? How do I balance that with some time for self or a quick trip to wherever? I think that balance is something it's kind of like where are you putting your intention?
That is so important, taking that step back and taking that time to create that balance. Let's transition for a second and look at words of wisdom. I love, love, love to ask for words of wisdom. And I want to talk about women's health because I've had so many friends and women complain about the lack of resources surrounding perimenopause and menopause. And I know that you mentioned earlier in the podcast that you are expanding your education in this arena. What advice do you have for women who are in this phase of life?
You're not crazy. Don't let anyone tell you that. You know your body. You know your body better than anyone. And your partner, whoever they may be, does not know your body better than you do. So when you feel these things, they're so real. Your hormones are a mess and you deserve to just simply be validated in that space. When it comes to menopause, I love that we're starting to have conversations. I think that's important. I think we are starting to get some resources. We're getting a menopause clinic that is just kind of taking off now here in Bozeman, which is great. We have providers who are wanting this information, but I also think knowledge is everything. And there's a difference between getting education from someone who's trying to sell you something and someone who just wants you to know. So there is great efforts out there to talk about testosterone or supplements or exercise or whatever. If they're trying to sell you something, you can listen to it, you can take it in, but also critique that and find resources of folks who actually are giving you information without ever getting anything from you. I just want to plug October is menopause month. And we're doing for our book club the Menopause Manifesto by Jen Genter, who also wrote the Vagina Bible, which is a great one. What Fresh Hell Is This is also another great book that gives a lot of information around menopause, but educating yourself about what you're experiencing and asking questions is really important. I also want to say pelvic floor health, getting a pelvic floor PT around that is also really helpful because one of the most common experiences of menopausal women is vaginal dryness. And because we are raised to ignore our pain, this can be really awful. There are a lot of great resources for pelvic floor pain and being aware of that so that you can get the education you need about what your body is doing and how it is changing is super important. And we can't just always throw hormones at it because testosterone doesn't always work, which is the most common treatment for it, which has its own pros and cons. And you're not crazy. We just don't talk about it enough to empower you to feel like you have the knowledge to manage it well, to endure it, not manage it, endure it well.
Well, I can tell you this, I definitely will be signing up for that October book club because that sounds amazing. So, my friend, one last question for you. Is there anything that I didn't ask about or that we didn't talk about that you want to make sure that we cover? Do you have any parting thoughts?
Wherever you are is great, and whatever you like is fabulous. I live by this like silly saying that's a kink saying that is don't yuck someone's yum. You're normal, whatever normal means. But that shame that surrounds sex can be really painful. And I think a lot of us feel it for different reasons. And being able to have a space to address it, I think, is just the most important. We don't want to yuck anyone's yum, and we want to celebrate people where they are.
Thank you, Dr. Hannah, for sharing your wisdom and your enthusiasm with us. Sex is not an easy topic to chat about, but you certainly have a way of helping us navigate this topic with grace, dignity, and respect. And listeners, thank you for tuning in. If you'd like to connect with Dr. Hannah or learn more about her work, I've put a link to the Ojai Collective in the show notes so you can check that out. Be sure to tune in again next week for another amazing and inspirational story here on the Two Gals and a Mic podcast.